We now talk to OCTA Research Fellow, Professor Guido David. Good morning, Professor. Thanks always for joining us. Now, as you well know, we've been hitting record high cases the past 2 days. What are your thoughts on recommendations of placing Metro Manila under alert level 4? Will this help to stem the rise in cases?
Well, this would probably help at some level if we decrease you know, capacities in establishments. So this is definitely something that that could happen. But right now we already have a lot of cases. It's not clear how much the marginal effect of this would be.
All right. When I spoke to you the last time, Professor, we were talking about testing capacity. Where are we at now in terms of that? And are we at a place where we can serve the needs of the community?
Yes, sorry. Actually, we're monitoring not just the testing capacity, but also the positivity rate. And in the NCR, we're already at 52% as of the latest data. So 52% is quite high. It's above 50%. So we may be starting to lose visibility. But there is hope that the positivity rate is already stalling, or in other words, it might be close to the peak. If that happens, of course, that would be great. You know, in the NCR, that means if it starts to peak, we may already start to see a downward trend by next week. But this is all preliminary. It's too early to say if it's already peaking. So we'll have to wait for the data in the coming days to see if the trend will hold.
All right, so you said 52% positivity rate in NCR. Do we know what it is for the rest of the country?
Well, it varies in many other areas of the country. I don't have the data for the whole country right now. I know it's probably lower, something like high 30s percent. But at the same time, while it may be close to peaking in the NCR, there are many other areas in the country where the positivity rate is starting to increase and the reproduction number is increasing, which means that the surge is starting to happen in many other parts of the country, including parts of Visayas and Mindanao.
Right, 52%. I mean, that just sounds staggering to me. And as you said, we hope it is the peak, at least here in Metro Manila. Professor, what is your projection for this week in terms of the number of cases? Are we going to hit 40,000? If so, by when?
Yeah, well, definitely. It's very possible that we'll hit 30,000. We're already close to 30,000. Right now, it might not be that clear yet if we're going to hit the 40,000 mark, if the NCR is already going to be close to peaking, because right now NCR has about 17,000 cases. It's not clear if it will still hit 20,000 cases, for example, in the NCR. So there are some developments going on. So again, it's not clear, but if it continues to increase, and if it doesn't, come close to peaking yet, then we might breach the 40,000 mark towards possibly the end of the week or early next week. But definitely that is not something that's clear in the trends yet, because again, within the next few days, we might see it starting to peak already. Again, this is just a possibility.
Right. Do you think, at least by your estimation, if we were to reach 40,000, would that be the peak already, or we couldn't say?
Well, it's difficult, Ria. Once we hit those levels, we'd already be starting to lose visibility of the pandemic with a high number of cases relative to testing. What that means is we might not be able to test enough to see the actual trend. So it might still go higher than that, but the visibility would be rather poor.
Right, meaning we wouldn't actually know exactly how many cases are out there. Professor, what do you think is the worst case scenario in terms of numbers and what that would look like for our healthcare system? I don't ask that question to scare people, but we also believe it is good to know what we might possibly have to prepare for.
Well, Ria, definitely if we hit 40, 50,000, this would be close to the worst case because after that, we'd be losing visibility already. If our positivity rate in the NCR reaches somewhere like 60% or something, again, the visibility would be rather poor. Um, at that point, we would not even really know if we were still at 50,000, 60,000, or 70,000. I mean, at that point, the numbers won't, or the picture would rather not be very clear anymore regarding the visibility. I mean, in other words, we won't even see 100,000 cases because we're only testing up to about 70,000. So that was the point of that.
All right. That, of course, is something that would affect hospital capacity. Right now, how do you think our health system is coping with the situation?
Well, Ria, the hospital beds are not yet full, but the staffing capacity is the problem. And this is also an ongoing problem in the United States, wherein healthcare workers are going down with COVID. And because of this, the reduced number of healthcare workers in a way reduces the capacity of the healthcare system, and they're not able to admit as many patients. So that's actually an emerging problem in itself.
All right, Professor, can we get your reaction to PGH now scrapping the quarantine for their healthcare workers who have been exposed but are asymptomatic?
Well, I'm not certain about the current quarantine protocols. I've actually not heard about this. So this is something definitely that has to be, studied, I think, because definitely, quarantine protocols are very important for, those who have been exposed, even if they're asymptomatic. So, it could be studied, but again, I don't really have that much input on that right now.
All right, thank you so much. Always good to talk to you, Professor. That was OCTA Research Fellow, Professor Guido David.